Hey everybody, I'm Tiffany Adams. I'm here with Eve. She's a 19-year-old female, and I'm going to be doing my head-to-toe assessment, physical assessment on her today. So the first thing I would do is perform hand hygiene, introduce myself, let her know what I'm going to be doing today, ask her if she has any questions, make sure she's comfortable, and then we'll start. Okay, so the first thing I'm going to do is take a look at your general appearance. So just your general state of health, if you have any, just look like you're in any distress. Check out your height and build, your weight, sexual development. Personal hygiene, grooming. I don't notice any odors. So we would also at this time assess Eve's vital signs at the beginning. Um, and then we'll move on to your skin. So I'm going to assess the color of your skin. I'm going to pull your shirt up a little bit. So I'm going to assess the color here, her hygiene, vascularity, any edema that she may have, which I don't see, injuries, scars, lesions, birthmarks, and tattoos and piercings. And Eve does have a lip piercing and a tongue piercing. Okay, so then I'm going to palpate your skin. So I'm just going to assess your skin for any moisture, the temperature, it's nice and warm. Also, I'm going to check her skin turgor here. Okay. And now I'm going to go ahead and do your cranial nerve exam. Okay, so there's 12 cranial nerves. And I'm going to go ahead and do your assessment of those. So for the first part of the assessment, I want you to close your eyes for me. And I'm going to have you smell something, and I want you to tell me what you smell.
Alcohol wipe.
An alcohol wipe. Perfect. So cranial nerve 1, the olfactory nerve, is intact. So for cranial nerve 2, we're going to check your visual acuity. So I'm going to have you stand, if you don't mind. Let's make sure we can see her. If you'll turn towards me. Okay, so I'm going to hold up numbers. I want you to cover one eye. And I'm going to cover this eye as well. How many?
2. 2.
Okay. Keep your eyes straight.
2.
Okay.
3.
Okay. All right. Hang on just 1 second. Okay. Let's see. So you can go ahead and have a seat. And we're going to check. So cranial nerves 3, 4, and 5 all kind of go together. They all check vision in different ways. So I'm going to check for nystagmus, which is basically a twitching of your eye. So the first thing I'm going to do is, okay, so I want you to hold your head still and just follow the pen light with your eyes. Okay. See? And these are the six fields of cardinal gaze. Okay. Alrighty. So now I'm going to have you stare straight ahead at just an object on the wall, and I'm going to come in and check your pupil reactivity. There we go. Okay. Perfect. Okay. Both are reactive. And now I'm going to check the accommodation. So I just want you to keep your eyes on this pen light. Don't move your head and just watch it. I'm going to bring it all the way into you, okay? Keep watching. Perfect. The pupil's constricted and she crossed her eyes as it came to her nose. Okay. So your pupils are equal, round, reactive to light, and accommodation. Everything looks great there. So now I'm going to check. So that was cranial nerves 3, 4, and 6, sorry, and that is the oculomotor, trochlear, and abducens. So now we're going to go to the trigeminal nerve, which is on the face. So I'm going to have you clench your teeth. I'm going to palpate this muscle. This is the masseter muscle. And I'm also going to palpate the temporal muscle. Now I want you to try to open your mouth. Okay? So cranial nerve 5, the trigeminal nerve, is intact. So now we're going to go to the facial nerve. So we're going to close our eyes tightly and then open. Okay? Open. Now smile, frown, and puff your cheeks out. Okay, perfect. So now we're going to go to cranial nerve 8, and that is the vestibulocochlear nerve. So I'm going to block one of your ears with my hand, and then I'm going to whisper something next to your other one and see if you can hear it, okay?
62.
Okay,
73.
okay. I'm going to come to the other side.
21. 13.
Okay, perfect. Okay, now we're going to move on to the glossopharyngeal. So all I need you to do here is just like when you have a sore throat and you're at the doctor, just stick your tongue out and say ah. Okay, let me get my light so I can see. Okay, great. The uvula did move up. And cranial nerve 10 is the vagus nerve. She does not have hoarseness. And could you swallow for me? No difficulty there? Okay, perfect. So vagus nerve is intact. And then we're going to check cranial nerve 11, which is the accessory nerve. And so I'm going to have you turn your head side to side for me. Then up and down. And can you, I want you to shrug your shoulders up. Okay, perfect. So our last cranial nerve is cranial nerve 12, which is the hypoglossal. So if you could, just stick your tongue out for me and move it side to side. Up and down. Okay, perfect. So that's all the cranial nerves. We've got that taken care of. Alrighty, so now we're going to move on to the head inspection. So I'm just looking at general shape, size, and symmetry. And then I'm going to palpate your scalp and your skull for any lumps or lesions, depressions, bulges, any sutures. And then I'm also, while I'm doing this, I'm inspecting her hair for distribution and color, any parasites. Everything looks good. It's nice and clean. And then I'm going to inspect your face for symmetry. It's symmetrical. There's no lesions, no discolorations. So I'll just palpate her TMJ here. Any pain there? Okay. All right. So now I'm going to inspect your frontal and maxillary sinuses. And I'm also going to palpate to see if you have any tenderness. Any tenderness here?
No.
Any tenderness here?
No.
Okay. Transilluminate here. Okay. All right. And then I'm going to percuss. Okay. So we're going to move on to the eye. So an inspection of the eye, I'm just looking at your eyebrows, your eyelashes, your eyelids, your lacrimal ducts, which are here, or lacrimal apparatus, which is your tear ducts, your conjunctiva, the anterior chamber and iris, also looking at your pupils, which we already did with the cranial nerve exam. So everything on the external eye appears normal. So I'm going to do an assessment of your internal eye. Okay. I'm going to look for the red reflex. Okay. And then I'm going to look at the optic disc, the macula, the retinal background, anterior chamber, and I would do that bilaterally. Alrighty, so moving on to the ear. So I'm going to inspect the auricle antenna and the external ear canal. Just look around here, no wounds, no discolorations, no lesions, any soreness. So
No.
that's palpation there. I'm going to move the, move the pinna, press on the tragus. Any pain?
No.
Okay, wonderful. Okay, so let me grab my otoscope. And I'm going to first look in the external ear to see if I see any cerumen, which is earwax. None present there. So then I'm going to identify the tympanic membrane, the light reflex, the malleus, and see if everything looks as it should. All right, and I would also do that bilaterally. Okay, so I'm going to inspect the nose now. External nose, it's symmetrical, shape, condition of skin is normal. So I'm going to look in your internal nose with my little light here and check your septum. Look at your mucosa, see if you have any turbidence or drainage, okay? So tilt your head back a little bit for me. Okay, looks good, and I would also do that bilaterally. Okay, so I'm going to inspect the vermilion border of your lips, which is the outer lining. I'm going to look at your teeth, your mucosa, your palate, which is in the top of your mouth. So if you would just open really wide for me, I'm going to use this light. Okay. All right. Everything looks normal there. No lesions. Okay. So moving on to your neck. So I'm just going to, again, first look at the size, shape, and symmetry of your neck. Everything looks symmetrical. Can you turn your head side to side, front and back? Okay, perfect. I'm going to check your carotid pulse. Just put my hand on your neck here. +2 carotid pulse, and I'll do that bilaterally. So I'm going to check the position of your trachea, and I'm actually going to walk around behind you to do that. Okay, could you swallow for me? All right. Any pain there?
No.
Okay, perfect. Okay. Let's see. I'm going to check all your lymph nodes. Any pain or tenderness?
No.
All right, so no tenderness there, so we're going to move on to your chest. So normally we would have the patient undress to the waist, but for privacy issues, we are not going to do that today. So we will just inspect as best we can with her clothed. Compare each side, and at first glance here, everything seems to be symmetrical. So I'm going to inspect her thoracic cage for the shape, respiratory movement, her rate and rhythm are even and unlabored. The depth of her respirations, there's no accessory muscle use. Everything looks symmetrical, excuse me. If you would stand, I'm just going to run my hand down your back. I don't feel any spinal deformities. So let's see, I may need to keep you standing for 1 second. Yes, so I'm going to palpate here, full breath in and out. Okay, thank you, and you can sit. Now I'm going to check for tactile primitus. Can you say 99 for me?
99. 99. 99.
Okay. And there's no, I don't feel any crepitus, which would be subacute emphysema. Alrighty. So now we're going to do the auscultation of your lungs. Grab my stethoscope here. I'm going to listen anterior. Out. Okay, I'm going to walk around so I can check your posterior lung sounds. Deep breath. And out. Deep breath. And out. Deep breath. And out. Deep breath. And out. One more. Okay. No rhonchi, no wheezing, all lung sounds are clear. Okay, so now I'm going to take a listen to your heart. So there are 5 areas where I'll listen to your heart with both sides of my stethoscope, the diaphragm and the bell. So we'll start with your apical, then we'll move to your pulmonic, Erb's point, tricuspid, and mitral. And then we'll also identify the point of maximum impulse. Okay? Just breathe normal for me. Can you stand for me? Awesome. Reach right here. Hang on just one second. I'll go ahead and just do the other side while I have you here. Okay, just one second. I'm just going to assess for the PMI. Right there. Okay, you would have a seat. Thank you so much. Okay. Okay, I'm going to have you, let me switch back over. I'm going to have you lean forward. Listen at the apex. Okay, you can lean back. And then if you will, lay on your left side. Perfect. Yes, perfect. Listen to the apex here as well. Okay. All heart sounds are regular. Okay. Now we're going to move on to the abdomen. And the patient has emptied her bladder before the exam. So if you would, just have a seat laying down for me. We're going to put your head on the pillow, and I'm going to get one for under your knees as well. Okay, you can lift your knees up for me. All right, is that okay? Comfortable? Perfect. Okay. So the first thing I'm going to do, and normally we would also have bare skin here, but for the purpose of privacy, we will not be doing that for this exam. So I would inspect for scars, dilated veins, any rations, lesions, any bulges that are visible. Inspect the umbilicus, make sure the location, contour is normal. Also inspect for a visible hernia at this point. So also at this point I would look for any pulsations, and then I'm going to auscultate. So I'm going to listen to your 4 quadrants of your tummy and your epigastrium. Just breathe normal for me. Okay, bowel sounds present in all 4 quadrants. Now I'm going to place my hand on your tummy and I'm going to thump with my fingers, okay? Which is called percussion. So I'm going to check the 4 quadrants, and then I'm going to percuss for your liver and your spleen. Okay. Okay, so the 4 quadrants, you can hear tympani there. And now I'm going to assess your liver. Okay. And then I'm going to go up, downward to upward. And you would assess the centimeters difference, and that's how you get your spleen size. Is this off? No, it's not. Okay. All right, so, oh, your liver. I'm sorry, that was your liver. So now I'm going to assess your spleen. Okay, and everything sounds dull as it should. So I'm going to do a palpation of your abdomen now and just lightly feel around. Do you have any soreness, tenderness
No.
to touch? I don't feel any bulges, any organ protrusions. Okay, abdomen exam is complete. So now we're going to move on to the musculoskeletal. If you would sit up for me. Okay, and I observed her walking as she was walking in with me. And I've already done the head and neck exam, so we're going to do shoulders. So I'm just going to palpate and see anything painful or tender here. No? Okay. So I want you to extend your arms straight up beside your head. Can you go backwards? Can you place them behind your head? Okay. Any pain there?
No.
Place them in the small of your back. No pain?
No.
Okay. Wonderful. So we're going to do hands, wrists, and fingers now. So I want you to spread your fingers on both hands. Make a fist with your thumb across. Can you hold my 2 fingers? Just grip my 2 fingers. Okay. Strong grip. Both hands. Flex and extend your wrist. Okay. All right. Now we're going to do feet and ankles. So up, down, both feet. Okay. Any pain? Difficulty? All righty. I'm going to hold. Have you turn side to side. Here you go. Okay. Let's do the other. Okay. Good range of motion. No pain. Can you flex and extend your toes up and down? Up and down. Perfect. Okay. Let's see. And can you do your knees for me? Just bend. Okay. Flex and extend. Okay. No pain?
No.
Okay. Let's see. Could you lie down on the bed for me one more time? We're going to look at your hips and pelvis. So can you pull alternately, one leg and then the other, pull your knee to your chest? Any pain, difficulty?
No.
Okay. Now flex your knee. I'm going to assist you. Bend your knee and then try to turn your hip in and out. Perfect. Any pain or discomfort?
No.
Okay, we would also do that bilaterally. Okay, if you would stand for me. All right, so normally also if you turn around, let me see your back. Or normally this would be done without a shirt. Easier to inspect, but we would do an inspection of her spine, make sure everything looks like it's aligned properly. Thank you, ma'am. Okay. So now we're going to assess your peripheral vascular system, which is your blood flow to your extremities.
Okay.
So we would check, when we do vitals, we would test her blood pressure in both arms to make sure that they're within 10 millimeters of mercury, one to the other. It shouldn't be a bigger difference than that. So let's see here. I'm going to check your pulses. So this is your radial pulse. Strong. +2 radial pulses bilaterally. Now I'm going to check your ulnar. plus 2 ulnar pulses. Brachial pulse, just reach up here. Plus 2 brachial pulse, we would also do that bilaterally. Okay, now I'm going to check on your feet, posterior tibial, dorsalis pedis, and popliteal. They can see me. Okay, thank you. Plus 2 bilaterally. Okay, let's see. Normally we would also inspect the breast for symmetric, being symmetric. We would palpate for any soreness, ask questions about any discharge or pain or tenderness patient was experiencing. We will not be doing that. And we would also normally do a reproductive exam too, but that's not part of today's exam. Okay, I'm going to take a look, if you don't mind, at your range of motion. If you would stand for me and just bend and touch your toes. Okay, any pain?
No.
And I want you to bend sideways. Okay, and backwards. Any pain, discomfort?
No.
Okay. And if you can, just twist your shoulders while you're holding your pelvis still. Okay. Normal. Okay. Okay, I'm going to test. You can have a seat. Thank you. Okay, I'm going to have you close your eyes and stick your arms out in front of you with your palms up. Okay, don't let me push down. Don't let me pull. There we go. All right, perfect. Now I'm going to have you put your arms over your head. Against me. Push against me. Okay. Put that then down. Okay, spread your fingers. I'm going to try to push them together. Okay, perfect. That tests abduction. Now put your thumb against your fingertips and hold it. Okay, and that chest flexion. Okay, now if you will, lay back down for me. Thank you. I'm going to check your flexion, so I'm going to have you raise your leg against me pushing. Okay, very good. Okay, now I want you to try to spread your legs apart. Okay. Alrighty. Alright, spread just a little bit apart. Now push together. Okay, very strong. Okay. Try to flex your knee, bend your knee. Okay, now bend it all the way up and try to straighten it out. This checks extension. First we check flexion. We would do that bilaterally. Okay, for plantar flexion, I'm going to have you push down against my hand. Okay, and for dorsiflexion, I'm going to have you pull up against my hand. Pull your foot back. Okay? Normal strength there. So as part of the nervous system assessment, I would ask you certain questions. So I'm going to tell you 3 things and ask you again in a few minutes about them, okay? So, yellow bus, red fire wagon, and, let's see, blue police car, okay? And I'll ask you in just a second. What's the date today?
February 22nd.
January 22nd?
January. It is January.
What's the year?
Oh, it's 2020.
Okay, and where are you?
I am at Auburn University Nursing Building.
Okay, perfect. So that just tests your orientation, which we also, throughout the conversation and the assessment, also assess just in normal conversation too, to see if there's any loss of orientation or any deficit there. Obviously, she's alert, oriented, appropriate. Okay, and the motor system, if you can, just walk from here to the wall for me. Okay, and then can you do heel toe heel toe and come back to me. Perfect. Okay, that's for the motor system. You can have a seat. Okay, now I want you to take your hands and pat your legs like this, over and back, over and back, over and back. Okay? That's assessing your coordination. And then hold your hand out and touch each one of your fingers with your other finger. Okay. Okay, so I want you to hold your arm out, bring your arm in and touch your nose. Okay, very good. So, let me get my tool here. Close your eyes. And I'm going to touch you with a soft object and tell me where, okay?
Cheek.
Okay.
Ear.
Okay.
Hand on the thumb.
Okay, perfect. That's just assessing your sensory function. Okay, now I am going to, let's see. Okay, see your hand. I'm going to draw a number on your palm. See if you can tell me what it is.
7.
Yes. Let's do the other.
8.
Okay, wonderful. Okay, close your eyes for me. Tell me where I touch you.
Chin. Right chin.
Okay.
Right hand.
All right, I'm going to touch the same place on both sides. Tell me where.
Shoulder.
Okay, very good. Now I'm going to put a familiar object in your hand. If you will, close your eyes for me. Just 1 second, and have you identify this object. Okay, close your eyes. You can feel it.
Coin.
Perfect. Okay, thank you. Okay, now I'm going to check your reflexes. Okay. We'll start with your biceps. Let's see, we'll do actually your triceps first. Okay, if you want to stand and let your arm hang. Okay. Just relax. Okay. That was your triceps and biceps. Now I'm going to do your brachioradialis. Just relax. Okay. Now we're going to do your knee. So if you want to sit on the edge of the bed and let your leg hang, hit right here. Okay, perfect. All right. Okay, so assess really quickly, make sure we've gotten everything. Can you tell me the 3 things that I told you earlier?
Yellow bus, red fire wagon, blue police car.
Awesome. Very good. Thank you. Okay, do you have any questions about anything we've done today?
No.
Okay, well, thank you so much for your time.